Hi. So you have decided to go for nursing, but you're just struggling on deciding which nursing program to go for, be it an LPN or RN or BSN or BSN Accelerated Nursing Program. In this video, I tell you 5 tips that will help you make the decision on which nursing program to go into. So if you're interested, then keep on watching. Hi guys, welcome back to my channel. If you're returning, thank you for coming back. And if you're new, welcome to the family. My name is Pearl. I post videos every week about nursing, medicine, faith, and lifestyle. In this video, I came up with 5 very important points that I think you should consider when you're deciding which nursing program to go into. This is my opinion, and I do not think that nursing or nursing programs are one size fit all. We all have different backgrounds and different personal situations, so I think it comes down to a very personal decision on which program to go in for. So let's begin. Number one, I think you should consider your educational background. By that I mean, if you are, say, a high school graduate, then all the options are on the table. You can go for your LPN, RN, BSN. It just depends on how much time you want to spend in school and again on your personal situation at home. But if you're someone who already has a bachelor's degree, then it really doesn't make sense for you going back to do like an LPN or RN before working your way to BSN, because that's just going to take up more time and more money. There are a lot of accelerated BSN programs out there which will take you with a bachelor's degree in whatever subject, so be it economics, geography, whatever, and you're going to complete your BSN in 15 months, which is almost the same time you spend in like an LPN school or an RN school. And once you graduate, you make more than if you went for the LPN route. So if you think about it, it really doesn't make sense for you to have your bachelor's degree and then going for an LPN or an RN route. I think it's better for you to just go for an accelerated BSN route if your personal situation permits you. Number two, I think it's important for you to consider your age and also your family situation. By age, I do not mean that if you're older or younger, you can pursue a particular nursing program. You can still go into whatever nursing program you want, but it might be more challenging to go into certain programs. If you are younger, say from high school, then like I mentioned, all the options are on the table because at that age you're usually most likely single and without a child, so you really don't have a lot of responsibility at home, as opposed to someone who is, say, in their 50s or 60s. At that time, I'm thinking you probably be married or have a partner or even have kids at that time. So it'll be more challenging to go for a rigorous program, say a BSN accelerated program, if you have those responsibilities at home. Also, you need to consider if you're someone older who has kids, and you don't have enough help at home, that it will be very challenging to go in for, again, like an accelerated BSN program. You might have to start at a slower pace from like an LPN to RN and work your way up. Also, you need to consider your financial support. Some of these programs are very demanding, especially with accelerated nursing, where you will not be able to work. So if you don't have that financial support at home, it makes it even more challenging to go through such programs. So you need to think about that. If you have financial support, say from your partner or from your family, then you can go through the accelerated route because you know that these people can help you with your other bills. But if you don't have that support, and especially if you have kids, then maybe go the LPN route, because that way, after a year when you're done with your LPN program, you can start working and then you have that money to care for your kids and other needs while you're going to school. So think about this. Now, I'm not saying if you're older or you have kids or you have a partner, you can go to certain nursing programs. You still can, but again, it's just gonna be really very challenging, and you're gonna have to work extremely hard to get through these programs. Some people even end up dropping out because there's just so much going on in their life that it makes it difficult for them to complete these programs. Also, you want to think about your end goals and how much time you're willing to spend in school. By end goal, I mean, is nursing your final stop? Is this your career? Or are you just using this as a stepping stone? This applies more to, like, for us immigrants, where when you come to the US, a lot of people tell you to do nursing because you easily get a job as a nurse, you easily start making money and taking care of yourself or your family back home. But then you have your own career path that you want to pursue. In that case, you can just go ahead and do your LPN because you're still going to make some money to cater for all these needs, and it's also just 12 months, so you quickly get done, you start making money, and then you go pursue your other career path. Also, if you say you're older and you really don't think it's necessarily for you to have a bachelor's degree, you just want a boost in your finances, then maybe LPN is a better option for you, because again, it doesn't really make sense going to school, taking out all these loans, and getting a bachelor's degree if you just need a little boost in your finances. So these are things to consider. Also, you want to think about where you want to work at. Like I mentioned in my previous videos, hospitals are leaning towards hiring more RNs versus LPNs. So if you're someone who wants to work in a hospital, maybe going for your RN or BSN is a better option for you, if your personal situation permits. Um, but if you don't care where you want to work at, then you can do your LPN and work your way up to BSN if that's what you want to do. Now, I'm not saying if you're an LPN you can work at a hospital. You still can. It's just going to be more challenging to get a job at a hospital if that's what you want to work at. I worked at hospitals which were implementing a new nursing model where an RN is paired with an LPN and a CNA, and they're giving a bigger patient load compared to other hospitals where the RNs only work with a CNA. At those hospitals, they will hire LPNs because that's the model they use. We have to think about how many of those hospitals use that model where they need LPNs. So just something to think about when you're thinking of which program to go into. Last but not the least, and to me this is the most important point or tip to consider, because we don't just want to get a degree, we want to get a degree that will improve our lifestyle after we get that degree. Because you're going to take out loans to get this degree or to pay for school, which is what most of us do. So you don't want to get all these loans and debts that you have to pay, and then you're not making enough money to pay up these debts and also better your life. So you want to consider how much these programs cost and how much you're going to be making after you get this degree. You want to make sure those balance, and actually your lifestyle or your earnings or salary after the degree should actually way higher or more than how much you spend getting this degree. Also, consider you have to look up different programs around your area. Is there somewhere where you can get this degree cheaper? Um, if I remember correctly, back in Ohio, to go to the community college where I lived, if you had been a resident for a few years, for a certain number of years, I can't remember exactly, you could go to the community college and your RN degree will only cost you about 6,000 versus going to another college or private university where it's going to cost you tens of thousands. So in that case, I think it will be wiser for you, though it will take longer to get your RN degree because there's probably going to be a wait list at a community college, but at the end of the day, it's wiser and better, in my opinion, to wait and get your degree cheaper than going to spend tens of thousands in another college when you're going to have to pay back that money. Also, you have to consider, is it possible for you to be an LPN while working to get your BSN degree? I know a lot of hospitals or employers had a tuition reimbursement program. So if you're someone who is struggling financially, or you don't want to take out all these loans, maybe you can start out with your LPN program, and then while you're working as an LPN, you can be trying to get your other degrees like your RN or BSN, and your employers can also reimburse you while you're going to school. So this is just another way to cut costs on getting your degree. So these are all the tips I had for you. Please really do take this seriously, because I really do wish that I knew a lot of this before going into nursing school. I hope this was helpful. Thanks again for watching, and please share this video and also subscribe to my channel if you have not already done so. And until next time, bye bye.